Okay, we're live. Welcome, ladies. I'm so excited today. We are going to talk to Dr. Leslie Koenig, Koenig. I said it the right way this time. Sorry about that. She is an emergency room doctor. She is also a member of the Armed Services in the Navy. And she is a master of figuring out how to deal with stress. And I think right now everybody needs this particular Facebook Live to just figure out how to deal with overwhelming stress. Even if you're a very calm person right now, it's a lot of stress in the world. Mm-hmm. And as we go into the holiday season, for sure, people's plans are being changed and life is being a little different than what it used to. And so I really thought she would be a great addition to talk about how do we deal with these next couple months as the stresses increase with holiday time. So if you don't mind welcoming Dr. Leslie Koenig. She'll tell us a little bit about herself, and then we'll just kind of talk about some great strategies and her wonderful resources she has for a survival guide to help us through these stressful times.
Awesome. Well, thank you for having me so much. I'm just so happy to get this out there and talk to anybody who needs to hear it. So thank you for doing all of this and having this platform. So
yeah.
So I'm Leslie Koenig. I am an emergency medicine physician. Let's see, I live in the Midwest right now. And yes, I did. I spent 8 years active duty Navy, and I got out about 4 years ago. So I loved my time. It was amazing. I met my husband while I was active duty. It was fantastic. So I did deploy to Afghanistan while I was in the Navy. So you can imagine I went through a couple stressful events. As we all do, really, but it was a wonderful time and I would do it again in a heartbeat. So I then had kids, which is a stressor of its own. Yes. And I think that's what really propelled me on my journey to fix things, because I now was responsible for another human being and like, oh my gosh, what do I do when I get stressed out? I can't exactly go for a run at the drop of a hat like I used to. So I had to find new strategies. And then the emergency room stuff was, I think just the shift work gets to you. And when I had my kids, I found out like the breathing techniques you do with labor, and some of the visualizations that they taught me sounded crazy to me. And then I was like, oh, wow, these really work. There's more to this that I really didn't listen to before or just really poo-pooed. So I really dug into it. And then I learned all kinds of things and I used them with my patients as I found out they worked for me. And I kind of distilled them down with patients. And I found that I could help patients really fast. So when COVID hit, I was like, what can I do for people right now? And I started writing the Stress Relief Survival Guide. I thought it'd be this small little pamphlet, and then it blew up. It just kind of wrote itself. I couldn't stop. And then I turned it into a video course and a Facebook group, and here we are.
I love that you're actually using this in the emergency room, because of all the locations that people would, I mean, usually are very high stressful situations, right? It's not, most of the time, not under their control. So that's fantastic that you're actually teaching people in these stressful environments how to then deal with the circumstance they're in, right?
Oh, yeah. Yeah. And I mean, I think some of them came to just as a human being, as a physician, comes to you naturally with, guiding people through a stressful situation just over time, the thousands of hours that we have on the job. But then I found that there was kind of a systematic way to do it. And I found that, you can have that really highly agitated person will respond to a certain technique, whereas they won't respond to this other technique. And then someone in a low level stress who just wants to talk but is in the emergency room will respond to this kind of technique, but not the high agitation technique. So that's how I structured the workbook, so that, depending on your level of stress, you could just quickly kind of triage yourself and then be like, what stress technique is best in this situation?
And since you've mentioned the workbook, do you mind telling us about your program? Like I know you said why you created it, but what is the program?
So let's see, the workbook itself is about 19 different techniques, stress techniques that work really fast. The book itself is just a one-page explanation of the technique, followed by a few pages of follow-up, to help you go through it and kind of to guide you, but also to reinforce the technique. So you learn it really quickly, just straight to the point, no fluff, just right to the point right there. So you can just flip it open, read, do it within minutes. And then it works within minutes. And then just as you're calmed down, then you can do a little bit of reflection. And then from that springboarded the video course. And in the video course, it's just an expansion of the workbook, but it includes the scientific evidence behind it. I go over real life scenarios that I've had as a person, like myself, or or in the emergency room, how I applied them with patients. So I'll give examples, of course, HIPAA approved, where I went through a situation where I was able to use it in the ER. So, other physicians watching this, they can go to the video course for ideas of how to use it with their patients.
So you actually provide a variety of different techniques so someone can find the right one for them, because It's not a one size fits all, right? Sometimes people are meditators, sometimes people are journalers. It just depends on what their, level of being able to figure out themselves, right? On what they can do. Is that what you mean?
Oh, yep, absolutely. Because I found that for me, tapping, for example, works amazing, but I've tried it with different, like my husband, and it kind of goes over so-so. And some people are journalers and some people do not like to journal at all. Some people are wanting to just get to the point fast, and some people want more in-depth. So there's something for everybody in both the workbook and in the video course.
Can you tell us about tapping? Because some people may not know what that is.
Oh, sure.
It's definitely something that's not always talked about. So,
Yeah, I was so skeptical. I was like, this cannot work. What the heck is this? As I was a microbiology major, I'm a very scientific person. I never bought crystals, and I thought it was something like that, like crystals and auras is that was what I thought in my mind. It's not at all. What it is, I learned it from Dr. Jill Weiner, and she's a certified tapping coach, and she offered me a free session. I never would have done it had it not been for free. So I'm very, very thankful that I gave it, I had an open mind about it. So it's called also the emotional freedom technique, and it uses different acupressure spots on the body. For example, one is on the karate chop point of the hand, and then on the top of the head, you tap, 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 and then inside, outside, under. So what you do is you tap on these parts of the body while speaking, typically, about a stressor. And the way I understand it, these acupressure points through MRI and other research that I've heard of, it actually goes straight to those fight or flight areas of the brain and minimizes the impact there. So you almost decouple the stress from the memory. So for me, the way it works is that I can discuss something without the stress rising at the same time. So, yeah. So for me, for example, going through, maybe many people have had that issue where you get cut off in traffic and then later on you're describing it and you get angry all over again. The tapping prevents that. So that way you're able to discuss something that raised strong emotions without the strong emotions coming up and interfering with processing the emotion.
So in some ways, you're kind of rewiring your brain to that memory, right? You're kind of telling yourself it's not how I perceived it the first time. You're perceiving it a different time. Is that kind of what you mean?
I think so. You kind of perceive it again more from a step back and more with using your prefrontal cortex, the higher brain functions that allow you to see it logically. Because oftentimes when you're frightened, scared, nervous, ashamed, or maybe it's a memory from childhood where you didn't have the processing power to deal with it, you're not able to use those higher brain functions logically as much. And what this does is it allows you to see it in that kind of 30,000 foot view, so that you can kind of see it like somebody else could see it.
And do you think for people, is it useful for people who have no idea what works for them? Would they just sort of try different techniques and then kind of find the right one? Is that kind of?
Yeah, absolutely. Yeah. I never thought it would work for me. And then I'm like an evangelist now for it. It all comes down to having an open mind, I think.
Well, and I think different for me, particularly whenever I have stressful situations, it doesn't always work the same technique. Like sometimes if I have, I deliver babies. So sometimes the delivery is very intense and emotional for other reasons. And so sometimes 3 deep breaths over and over again works for me. And sometimes I have to literally sit down and write it out and let my brain kind of almost as if I had a friend I could just vent to.
Oh yeah.
To do that. So I would imagine this would be fantastic because then you basically have a resource all the time that can say, well, I tried this thing and now I'm still mad at the guy in traffic. Step 2, let's try something else and see if this is going to be a better technique. Because I think I would guess, for me at least, there's times when it doesn't always work the same way, you know?
Mm-hmm. Oh yeah, definitely. And that's why in each kind of, so as I mentioned, kind of triage level. So if you're like, you kind of check your body and your heart rate's elevated and you're really clamped up and you can't calm down, you're probably kind of in the red zone. So I offer techniques there. And if one of them doesn't work, you can move on to the next. And if that doesn't work, you can move on to the next. There's a couple of them in each stress category. And you can absolutely swap back and forth and combine them. I do that all the time. So as I'm, in a really high stress mode, I may use a breathing technique. And then as I calm down, I'm still not where I want to be stress-wise. Like I'm still stressed out, but I'm like, you know what? I'm ready to journal. I'm ready to do the rain technique. So you can definitely combine them. So you can kind of de-escalate your own stress.
You must use this with parenting.
All the time. All the
time. Because sometimes as a parent, it's the walk in the other room technique, or, there's many different moments where you're kind of pushed to your max and you have to figure out what is the way you can deal with it besides a glass of wine or two.
Oh yeah. Yeah. Yep. It's funny, in my Facebook group, I do videos now and then around my house, I'll be like, oh my gosh, I cannot believe this just happened. I'm just going to video myself doing a technique right now.
Yeah. Do you use this with your kids? Do you use these techniques with your kids?
Yeah. Yeah. Some of them are more involve some logic and writing, and my kids are 5 and 3. So there's a little bit of limitation there. But I can kind of baby it down a little bit. It's once you know it and you teach it to others, you can definitely, I guess, modify it for different ages.
Yeah. And does it say anything in there about kind of how to use it with children, or just sort of the old figure it out what works best with your child kind of?
It's figure it out. It's designed for an adult or teenagers, really. I know that people have contacted me and said that their teenager really liked it. So it's a very self-directed kind of a thing. I wanted it to be very straight to the point, just introduce the techniques and get those techniques out into the world. But that's a good idea. I may take you up on that idea to modify it for that.
Listen, if you do anything to help parents with figuring out how to deal with stress, because, we're at home. I mean, I don't know how it is in where you live, but we've been home with kids since March 17th. They haven't had in-person school. So as this time has sort of continued on with COVID, there's so many different anxiety points that come up with kids. They can't see their friends. They don't get to, they don't have the same routine anymore. So I would imagine from a parent, at least from my perspective, the idea of being able to teach them different techniques, because your kids are different, and how they can apply those. My kids are 9 to 13. So they can do some of these things, but it's sometimes hard to know where to start,
Oh yeah. Yeah. I know that there is definitely a few, for example, with kids, I've heard of one, and it's not in the book, but here's just one that I know of, with helping kids to breathe deep. Sometimes they don't get it. So you say, blow out the candles. And then as they breathe out, you kind of drop your fingers. And so most kids, maybe 3 and up, can understand that, like, now take a deep breath. Okay, now blow out the candle. Okay, no, now you have like this many more. Take another deep breath. So I know that is one technique that that works with young kids.
Yeah. And that's great anyway for any age, because sometimes even 10 or 11-year-olds are, they're speedy about, let's just get it done. And it's like, well, we need to actually make this useful for ourselves, right?
Mm-hmm. Yeah.
It doesn't work unless it's actually helping to de-escalate the problem.
Mm-hmm. Yeah.
From that standpoint. What is it? Do you, in case you might have this on top of your head, tell us a success story, like a success story of a patient or a friend or a family member who used this that thought it was extremely helpful.
Okay. So yeah, I mean, I have a few in the course, and one of my favorites is, there's a technique that I developed called the battery technique. And I'm fully, like, I can teach you guys about it, but I had a patient who was suicidal, and he and I sat for a bit, and we were chatting, and I kind of got a sense of where his stress level was. He had kind of calmed down a bit. He was no longer actively, wanting to jump out a window. And I said, let's try this technique. And so I gave him a pen, and here, I'll just teach you at the same time. Yeah. But I had him, because he was speaking very negatively. And I got the sense that he was just needed a little bit of a mindset shift. And that's often what we just really need to do with our stress, because the stress will always be there. And there's nothing you can do to change your circumstances. So you have to change your reaction to it, or even how you think about it. So I was like, maybe this will help his mindset. So with a pen, I had him draw a negative on his left hand and a positive on his right hand. So that way, when you kind of hold the pen like this, you're kind of like charging positive, negative. And what this is kind of a mindset experience where I said, okay, so take the pen and just tell me about what you're thinking about now. And so he starts going off about COVID. And he has the pen in his negative hand. And he's like, and then this happened, and this happened, and this happened. And I said, okay, so now when you're between thoughts and just looking at your mind, that's when you hold it here and you're charging and you're just looking at your thoughts. Now, are your thoughts still negative? And he'd say, well, yeah, because then I forgot about this, and then my friends, and etc. And then I said, okay, now look back at your thoughts. And so he would charge. And this is where the goal is. I was like, so just so you know, this is where the goal is. And I was like, is there any way to get the pen in your positive hand? And he sat for a minute and he said, well, you know, because of COVID, I'm actually home with my family more, which I did not expect. And I actually had an experience with my dad that really rekindled a rift in their relationship. And he's like, you know, and then he's like, I hadn't even thought about that. And then it suddenly, everything shifted. It was just that he was, you know, negative thinking, no, it's still negative thinking, nope, still negative. But I just asked him, can you get the pen in the right hand? And suddenly it's just everything shifted. He was like, wow, thank you. I never realized that my situation had any positivity to it. And honestly, he did great. He actually got to leave the ER. He fully contracted for safety. His dad came and they were all very thankful. So
when our brains are kind of, and we tend to snowball things, right? We start going with, well, I didn't, get to work on time, and then the coffee spilled on me, and then the first patient was late, and then comes this, and exactly what you said, you went from the negative to the positive, and he was able to realize, why am I focusing so much on this side instead of this side? Yeah.
Absolutely. And the key thing is like, it's great to be positive all the time, however, a dog with a bone is positive. My 3-year-old with a cookie is positive. The thing is like to recognize that, and to really be present in that moment of like, oh, wait a minute, you know what? I'm being really positive. I have a lot of good things happening in my life. And this is almost like can lead to feelings of like gratitude, acceptance. So actually like being positive and knowing it, being negative, but also knowing you're being negative and just seeing the storm and the tornado of thoughts as they go. And that way also by focusing on it, you're grounding yourself because you're using this tactile function to go back and forth. And also you're taking that again, that bird's eye view of your mind. So you can see the chaos that it is and also uncover a few things that you didn't even realize you were thinking. But by using that tactile method of looking at your thoughts to ground you and to keep your brain organized, I think that it just adds another dimension to seeing your true situation.
Yeah, I think when they're changing their mindset, but actually physically doing something, it seems to set in a little bit better. It's kind of like therapy. When they do therapy with kids, they often have them do things while they're talking out their emotions. Like they're almost like doing play therapy, or they're doing things where they're sort of moving their hands and moving so that they can actually almost keep it in their brain longer. That sort of reminds me, like, because you're taking one thing and you're physically moving it over and doing something, as opposed to you probably asked the same patient who said, well, just tell me 5 things without even making them do anything. I wonder if it would be the same response, because they would kind of not be actively moving. And so it kind of almost sets it in your brain. That makes sense.
Yeah. And then also you have the positive and negative on your hands here to kind of remind you of like, man, I am really focusing on this negative aspect. And then once you actually, I think, go through it, you kind of just realize like, man, I'm doing nothing but negative. And I'm here looking at my thoughts, and I have the possibility of going to the positive. And I think you see also in it the choice that you have in it. And I think some people get lost in that snowball of thoughts. They feel like there's no choice in it, and the thoughts are fully real, fully true, when in fact you have the choice to move it over. And so you just have to flip it to the right hand, you just have to make it happen. So.
And so for that particular patient, do you tell him to do that every day? Do you sort of say, hey, let's, on a daily routine, this is what makes sense for you? Or how did you tell him to sort of move forward with that technique?
Well, as an emergency room doctor, I kind of do give the discharge instructions, and I often, hopefully, don't see them again.
Yeah.
So just about everybody, I recommend an onslaught of things. I recommend the top ones I recommend are download something to your phone that is going to keep you accountable. So I mentioned some of the top meditation apps. So Calm, Headspace, 10% Happier. And I just advise that they look into one of those. And again, I don't have any monetary affiliation with any of those. I just have tried them all, and I recommend them. So
what is your favorite? Can I ask you what your favorite is?
Happier. Love 10% Happier.
Okay.
So yeah.
I've heard of that one. I actually know a lot about the Calm one because I've used that with my son who has ADHD, and so sometimes has moments where he can't go to sleep and focusing. And so I've used the Calm app before because it has these 10-minute meditations every day, and then they also have like music.
Yeah.
So he likes the rainforest and like the noises to go to sleep. What is the 10% Happier one?
So that's more. It was started by Dan Harris. He is actually a news anchor on Good Morning America. And I liked that. I got into that because I liked his skepticism about all of this. And I really related to that. And also he's got a real self-deprecating humor. So in it, he has different courses that are like relationships, wandering retreat, performance for like sports performances. So he has different teachers come on there. They do videos and then they go into a meditation. But it's not like music or, for Calm, I love their sleep stories. I love those because I just kind of like listen to something about falling asleep on a train, and next thing I know, I'm actually asleep. So I love Calm for that. And I love how Calm has the video on it too. So I think that would be really good for kids. So, but with 10% Happier, it also has its roots in Buddhist traditions, where they will mention some of the different types of meditation with their like Vipassana, meta meditation forms. So.
Yeah, and I probably with real life stories, it probably makes it relatable to some people too, right? Because they would relate to some of the stories, I guess, that would be on it from like teachers or whoever else would be sort of giving those particular thing. And yeah, the Calm doesn't have any particular stories, but Matthew McConaughey reads the story on it, so that sold me.
Yeah. That was a good one. That was a good one too. I like that one.
Yeah. And so those apps you tell people, I'm sorry, I interrupted everyone when you were talking about the different things that you tell them at discharge. So apps that help them with meditation, was there other techniques?
Well, I can't self-promote at work. It's kind of a conflict of interest. I almost want to tell them like, just get my book. It's all in there. So I try to squeeze in a few techniques when I'm like even when I listen to their lungs. Sometimes if they're really not taking deep breaths, I'll teach them the paced breathing technique, and I'll even draw it on the whiteboard. And I'll just be like, in 4, hold 4, out 4, hold 4. So I will definitely, but I can't tell them about my book. So I will point them towards mindfulness-based stress reduction, which is we have discharge instructions for. So I'll point them towards that, the app, because everyone has their apps on their phone. And then, of course, a local mental health person who they can connect with if they need to.
Yeah, and I didn't mention that, but I hope that's obvious to most people listening that this is definitely not a substitution for seeing a mental health provider, either psychologist or psychiatrist. It's really about augmenting or kind of making that what you learn from those particular people work for you on a daily basis. Because a lot of times in those clinic visits, just like why I created this company, is there's not a lot of time to go over individual techniques for you. So it's a way that you can actually figure out based upon what your psychiatrist or psychologist thinks is the right way to move forward. You can actually use this to help make that more successful, to definitely make it more successful because, some of those health professionals will suggest certain things, but this is comprehensive, what you're talking about. I mean, this is a way you can actually go through and say, this works for me. This works for maybe my kiddo. This works for my family member. Like it's a nice guide to be able to help everybody, which is not often easy to do in sort of a clinical setting,
Yeah. And building that relationship with someone who knows you and can track you week to week, and then, use medications if necessary, which I fully believe in. Medications are absolutely necessary in mental health at times, but having a licensed person to help you with that. But then I honestly feel like if you also have to do some of the work yourself to get rid of the negative thoughts and work through some of the things in another way. So kind of lifestyle modifications as well, mentally.
Yes. Well, all and definitely all mental illnesses are tied to health as well, right? So nutrition and lifestyle, that's something I definitely believe in, that, if you are struggling with those particular things, you definitely have to look at what are the lifestyle things that are going on. Like, are you sleeping enough? Are you getting enough water? Are you walking? Are you doing those other parts in your life? Because those release good endorphins that make you happy. So you always have to look at those components. And nutrition. For some things like ADHD, like my son, nutrition plays a big part, because some of those kids actually have to really be careful with their diets and, careful with their processed sugars and all the other things. So it all works together. It's not one particular thing. I definitely think there's a more holistic approach you can take to all, chronic illnesses, for sure.
Oh, yeah. And I 100% believe in the integrative approach, where it's, the mind body connection, and then how you deal with all of that. I've definitely seen it in my patients, and but yeah, there's only so much I can pack into an emergency visit.
Yeah.
You wish you could pack in so much more, and then also you kind of can overwhelm people with, all of it at once. And, it's kind of good to have those small steps to reach your bigger goals.
Yeah. And for you, giving these people techniques as well, because a lot of times you can't go in to see somebody right away. So this gives you a chance to sort of have something on an emergency, right? You get off the phone with your aunt who drives you crazy, and you got to figure out how to decompress on a quicker basis. You can't just call the psychologist and say, I got to talk to you tonight. So this is a fantastic way to basically have other options for people to then, if they needed to change something, like an immediate response.
Yep. Yeah, definitely. Like the tapping one is really good for me. So like I get off the phone and it's like, I can't, I just feel agitated or something. I can just do some quick tapping, or at work, if something happens, like, a patient yells at me. I had a patient try to punch a nurse the other day, and yelling and screaming at me, of course, highly intoxicated. But it was one of those, just, you can only do so much before you see the next patient. There's literally like almost no time to calm down yourself. So just hopping into the, bathroom really quick and just being like, okay, just take those deep breaths. That wasn't anything personal. She's, highly intoxicated. Yeah. So it's a good, just quick relief tactic.
Are you finding as well that there's more people having high levels of stress because of COVID and the way things are going? Yeah, I think I would imagine the emergency room that I talk about it daily, nearly to every patient, especially because I take care of pregnant women. So the stressors of how is this going to look different when I show up at the hospital, and how am I going to have a baby and be isolated, and all these kind of things that happen, that I would imagine this, that this is a bigger need at this point.
Yeah, it's huge. Really, really huge. It's, I'm sure you've seen the chronicity of it. People are trying to hold it together for so long, and then something just kind of makes it come to a head, and sometimes it's a somatic thing. I've seen a lot more young chest pains, a lot. And of course, COVID itself causes pleurisy a lot. So seeing that, but then people are afraid of the worst happening, and you have to, there's a lot of stress on both sides, I guess. So patients and doctors and nurses. So it's been a lot. A lot of it is just listening to each other and being understanding and supportive.
Yeah, I think that's actually the biggest part of it. Is I try to tell people it's okay to be stressed out right now. Like, it's okay. Yeah. It's totally normal. Like, even me, who tends to be a pretty chill personality, like, there's definitely days when I'm like, I am so tired of wearing this mask. I am so over this. Like, and I think it's okay to say it's okay. It's okay that we're feeling that way, because this is not a normal circumstance, and it's not a normal environment that most people are finding themselves in, especially people who are very used to being around family during this time of year and being on big gatherings and having their very set schedules. I've noticed it's been very difficult for them to pivot away from their normal routine,
Yeah. Yeah, and that's the thing is it's you're, as you know, as you said, it's perfectly normal to feel stressed because there's a reason to be stressed, and it's something that we know in medicine. You know, the situational reaction, and it taxes you no matter how prepared you are for it. And that's kind of what I wrote with the stress relief survival guide. Was with those acute stressors, I actually felt pretty good really quickly, and I was one of the first to get quarantined. And when I got back to work, everyone was really stressed out. And I thought, oh, you're still stressed about that? And I realized there was quite a difference because I'd been doing all these techniques. I really ramped them up and really got committed to all of them. And some people just don't have those kind of in their toolkit. So you kind of go back to what you know, and you think you don't have time to learn anything new. So people are like, well, I don't want to start meditating. It didn't work for me, but a bottle of wine does the job. But then, you know, multiply that by many months, and then the problem is still there, and the bottle of wine turns into 2, you know, and then they come into the ER. So yeah, that's why I thought this would be like a good, quick, learn it really quick so that you maybe don't have to go to those maladaptive techniques.
So some people recognize those things as stress and know that's what that means. Like, no, you know, yep, this is my normal. This is my right now. For people who may not recognize those, what do you think would be the common symptoms that they sort of would be having that maybe they should recognize as that's actually you're overwhelmed?
That's a really good question. And there's a lot of different answers to it. And I one of my favorite techniques is, or my favorite ways to know, is to, it sounds, I don't know, when I first heard it, I was like, that sounds so cheesy, but to pay attention to your body. So to check in with your heart rate, check in with your muscles, and just see if you're holding a lot of tension in your jaw. Are you getting more frequent headaches? Are you getting more back pain? Is it spasming when you and your spouse have an argument? And then are your kids, you know, not acting right because they got off a routine and therefore you're off your routine? And then what kind of things have you given up and what have you done to replace them? So for example, a lot of people couldn't go to the gym anymore and that was their outlet. So you may notice you're getting more short-tempered at home. And people will often tell you when you're not acting like yourself. So I would say is to keep an open mind to what people are telling you, because if people love you, they'll tell you. And if you're at home alone and you're feeling like you gained 10, 20 pounds, that's because you're probably stressed out, and maybe look at what you're, you know, doing as a technique to adapt. Because we're all using our kind of survival skill mode. But then it gets to a point where survival skills need to turn into chronic ways to figure it out.
Yeah. And for me, I recognized that I had a stress issue when I was trying to lose weight. I hit over 40, and it's harder to lose weight when you hit over 40. And so I was trying all the usual techniques and clean eating and all these things. And my friend actually said to me, she's like, you know, have you ever looked at your stress level? And so it kind of clicked to me. I was like, maybe I didn't have consistent sleep. You know, I was just an OB. You don't have very great sleep anyway, yeah. But I noticed, you know, sometimes I'd stay up till midnight, sometimes it'd be 10, and then sometimes I'm tired, then I have an extra cup of coffee. Mm-hmm. You know, so I had all these kind of little bit crazy thoughts. And I was like, you know what? I never really actually did look at stress. Like, to me, it seems so silly. I was like, there's no way stress is making me not lose weight. Like, I'm going to the gym, I'm doing my hot yoga, yeah. I'm passing on the ice cream when my kids eat it. You know, I'm doing all the things I'm supposed to. And then when I started actually doing, I use a 5-minute app. It's an app that makes you in the morning say what the day is going to be. So you set the intention for the day. So it asks me questions about what I'm going to do today, what is going to be like my, you know, I am what, like affirmation. So okay. I started doing that. And at the end of the day, it reminds you to say, what was your day like? So I have to actually sit down and think about, like, did I meet those goals? Like, did I actually do what I wanted to do from a healthy standpoint? And it actually really drastically decreased my stress. I would fall asleep much better. Yeah. Awesome. Because I wasn't thinking about all the bad stuff that happened the other day. I wasn't thinking about the fact that, you know, someone got mad at me because they waited 15 minutes for a visit, or I was late, or dropped coffee on me, or whatever. I was actually having to remember what I was supposed to start the day off and then finish that way. And so it actually ended up helping me lose weight. And I was able to lose the 5 pounds I was sort of gaining from just stress.
Oh, that's awesome.
So I like you said, you kind of were like, no way. And I felt like that too. Like, no way. Stress, these people are fluffy. That's not my jam. I'm not fluffy. And I have appreciated how much that, trying to go to bed at night with stress is not good for your diet, not good for your brain. And just overall, it's long-term very bad for you to continue to have those high levels, that cortisol levels that are through the roof all the time. So I love that fact that you have so many different options for people, because it's not always, I didn't know I was going to be someone who could do well with a 5-minute app. Like I didn't know it was going to be something that would work. Meditation didn't work for me because I can't sit still for a few minutes to do it. So this was actually a great technique. So I like that you offer so many different things for people to figure out themselves, right?
Oh yeah.
To listen to their own bodies.
Yeah. And it's surprising how well they work for something so simple. I mean, I just thought like journaling, a notebook, a $2 notebook from Walmart, what power does that have when people pay thousands of dollars to therapists? They're the ones who are going to get the response. And I've had a lot of people, especially with COVID now, get very frustrated that they don't have access to mental health because everything's via Zoom and all their appointments got canceled and they can't get in for like 2 months. And what can we do right now? And the answer sometimes is just as simple as that. You just have to try out different things and figure out what works for you. And it can decrease your stress just as much as an appointment with a psychiatrist or a psychologist, until you can, just kind of like as a bridging technique until you can get in to see them. So.
And since you are not at work, you can tell us where we can find you.
Oh, sure. Well, thank you for asking. StressReliefSurvivalGuide.com is the website where you can access my video course, which is, I believe it's 4 different modules, a bunch of bonuses, a bunch of extras about how to boost your happiness level, and all evidence-based, proven by research, with worksheets and stuff to go along to keep you accountable. So StressReliefSurvivalGuide.com. I am on Facebook as a Stress Relief Survival Group. And that is one way. And then on Amazon, just Google either my name, Dr. Leslie Koenig, or Stress Relief Survival Guide. And I have the workbook right there that you can buy for yourself. You can give it as a gift. I don't have a copy in front of me, but it's really well designed. I love it. It's like this. The cover has a bunch of mountains and stuff on it.
Yeah, it's beautiful, the front cover. And definitely you can get it in 2 days, so it can be there for Christmas.
Yeah, I think they're printed to order, so get it now if you're thinking about it. So.
Yeah, for sure. And the Facebook group is set up so that you can have other people kind of support you in this kind of, if you're struggling with something in between and need some extra help, the idea is sort of other people helping teach you, right?
Yeah, absolutely. There's all kinds of other people in there willing to support you, ask you further questions, and just help you through things. Some people kind of use it to vent a little bit, but what I like to see is people who come in and, just try something out. But if you need a little extra help, that's what the group is there for, to help you with your stress. And like I said, there's different videos on there. There's a tapping tutorial in case you're interested in that. It's me and Dr. Joel Wayner, and we go through actually a tapping for anxiety and stress. And then I go through different techniques, even as a parent. And a lot of times my kids will totally bomb my videos. So you will probably see my kids just jumping on me as I'm like mid explanation of a technique. So if you're a parent, you may get a kick out of that.
Well, if they're on this, they've seen my kids in my videos too. That's part of making you who you are. So it's important to always, be present with your kids and be present with the people that they know who you are, and that's part of you. So definitely. Well, I thank you very much for letting us talk to you today. Was there anything else that you wanted to say that I didn't mention?
No, I mean, that's it. Like, I just want to get the video course out there and get the workbook for people who need it. Like I said, the workbook, I think, is a great thing to give to new trainees as well, or somebody just, again, looking for it's almost like a get stress relief quick idea. So I know a lot of new trainees feel like they may have some stress, but don't have the time. But that's exactly why I wrote this. I wrote it for people who want stress relief, don't have time, 5 minutes tops. So if you have anyone like that in your life, definitely check out the workbook.
And And we very much appreciate the fact that you do that with people in the emergency room. I think that's such a beautiful, unique idea. I think that they are very lucky to have you as their doctor in the emergency room, because usually that's not the usual, that someone takes time to sit down and try to help somebody through a stressful event. So I think that's very beautiful. And I from society at large, we appreciate you.
Oh, thanks. Yeah, anywhere I can, sometimes even the ER gets crazy, and that gets, the medical has to come up front than the stress. I wish I could do it more. So I'm glad I had this opportunity.
Yeah. Well, thank you very much for participating. And I'm going to end the Facebook Live, and then I'll just chat with you afterwards for a few minutes. Is that okay?
Yeah.
Okay.